What are you doing October 1st through 3rd? I want to hang out with you just south of Nashville, Tennessee, down in Franklin. I'm going to be keynoting the Mental Health Marketing Conference, and I would love for you to be there. We are also sponsoring the clinical track, where there are going to be tons of amazing trainings, all for you in private practice. This is the national gathering for marketers and clinicians in mental and behavioral health. You're not going to want to miss this awesome conference. It's the one conference I'm keynoting this year, and you can read more over at mhmarketing.org. Also, Steve over at Mental Health Marketing has given 25% off to any Practice of the Practice listeners that want to come to this. Whether you're coming in person or online, you're going to want to use promo code Joe at checkout to get 25% off. I would love for you to come in person for my closing keynote on Thursday, October 3rd at the Mental Health Marketing Conference. But if you can come online, that works as well. Can't wait to hang out with you in Tennessee. Again, that's mhmarketing.org and use promo code Joe at checkout to hang out with me October 1st through 3rd, 2024. This is the Practice of the Practice podcast with Joe Sanok, session 1024. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast, where we help you build a thriving practice you absolutely love. We want both sides of that. I was just talking to one of my consulting clients who is building some really cool stuff outside of her practice, and I'll be having her on the show to talk about that. But then we were going through kind of some of the money and the logistics of her practice, and we want you to thrive. We want you to do well. We want you to have the basics covered in your life, but we also want you to absolutely love it. There's so many ways that you can make money in the world, and we want you to love the way that you're impacting the world, you're impacting your community, you're impacting your own life. And so we want you to thrive, but we want you to love it in the process. So we cover marketing, we cover SEO, we cover websites, we cover operations, and we cover clinical things on this show. And depending on the week, we're doing this 5 to 7 days a week now because of our amazing sponsors and our amazing guests. So really excited today. We're talking Alzheimer's, which is something I don't know that we've covered on the show. If we did it so long ago, I don't remember it, which is not a intended Alzheimer's reference. But today we have Dr. Heather Sandison, and Heather is a distinguished naturopathic doctor, has devoted her career to providing compassionate care and innovative solutions to those affected by dementia. Renowned for her pioneering work, Dr. Sandison has integrated groundbreaking holistic and multimodal interventions, seamlessly creating clinical, residential, research, and educational platforms. Her relentless dedication has not only transformed the lives of patients and caregivers, she's also set new standards in the field of dementia care. She's also the author of the new book, Reversing Alzheimer's, the new toolkit to improve cognition and protect brain health. That came out June 11th through HarperCollins. Heather, welcome to the Practice of the Practice podcast.
Thank you so much for having me, Joe. It's a privilege to be here.
Yeah, I am really excited about this conversation. Both my parents, luckily, are still alive. They're in their 70s. Both of my partner's parents are alive. You know, depending on which branch of the family you look at, there's dementia, Alzheimer's from, previous generations. And so just personally, I'm really excited about this conversation. I value my health. I'm type 1 diabetic and a history of cancer. So we've got a lot to dig into today. But Heather, how did you get into dementia and Alzheimer's as a focus for your career?
I had been told that there was nothing you could do for someone struggling with Alzheimer's, that to suggest that you could was to provide false hope. And Joe, I had the privilege of being trained by Dr. Dale Bredesen. I went to an integrative mental health conference and heard him speak, and he was saying that you could help patients reverse dementia and Alzheimer's. And I thought, wait, what? Like I had heard that you cannot from well-meaning, well-educated instructors, other clinicians who I respected a lot. And here was this guy saying, no, that's not right. You can stack all of these interventions that I learned about in naturopathic school and actually get an upregulation of function in the neurons and a recovery of cognitive capacity. And the way he described it was compelling enough to me that I went ahead and signed up for his training. And then although my confidence wasn't that high, I was still a skeptic. I hadn't seen it work in practice. I was on his list of trained providers in 2017, right when his book, The End of Alzheimer's, was launching. And so there was a lot of, PR around this. It became a New York Times bestseller, and patients started showing up in my office, not knowing that I wasn't fully bought in yet. They came in with a lot more confidence than I had. And then I saw them getting better over and over and over again. And in that process, I basically switched to believing that not only was telling someone who had dementia that they couldn't get better wrong, it was actually to do harm and engender false hopelessness, right? This idea that there's nothing we can do for dementia or cognitive decline or even diagnose Alzheimer's is outdated. It's now factually inaccurate. There is actually so much that we can do to support our cognitive health at any stage of life, at any end of the spectrum, whether we're in prevention, in those early stages, or we have full-blown Alzheimer's. One of my earliest patients had a MoCA score of 2. So this is out of 30. A perfect score is 30. Normal is 26 and above. And she came in speaking in one-word sentences, just yes or no, but I could see her tracking. I could see that she was there, and she had this bright, beautiful smile. She was dressed in like this big floral pink print and a black studded leather bag. And her husband was so committed, so devoted to her. It was so inspiring and sweet. And they did everything. They went home and they did it all. And in just 6 weeks, her MoCA score had improved from a 2 to a 7. And she was speaking in complete sentences. She wasn't going back to work. She wasn't cured. I would never use that word. This is definitely about a reversal of the disease process and a lifestyle that needs to be maintained. However, their lives were radically improved. And when I saw what was possible for her, I couldn't help but think, what about everyone else? Everyone else who's at early stages or at genetic risk? How might we be able to avoid a lot of the suffering associated with this awful disease?
Mhm. Heather, let's go through a handful of things that maybe are misconceptions or even things that research quote supported for a while, or maybe professionals were purporting in regards to Alzheimer's dementia that maybe now the research has changed our perspective on or needs some updating. Where would you start in regards to maybe kind of reassessing things that maybe were thought to be standard? Like you said, Alzheimer's is forever. There's not much we can do about it. I think that would count as one of them. But what other things would you say are typical preconceived notions people have about dementia, Alzheimer's, that needs some updating?
Yeah, so this beta amyloid plaque hypothesis, right? This idea that Alzheimer's is caused by misfolded proteins certainly needs some updating. Now, those misfolded proteins, tau proteins or amyloid, these are correlated with Alzheimer's. Don't get me wrong, there is certainly a connection. We see people with ApoE4 are more likely to develop those amyloid plaques, but they are in response to something. So whenever someone says, oh, Alzheimer's is caused by inflammation or Alzheimer's is caused by amyloid plaques, what caused the amyloid plaque? What caused the inflammation? We want to go one step above that to really get at the primary root cause. And so I like to use this metaphor of, okay, if you have a house plant and your house plant is struggling, right? You're not keeping it alive. You don't point at it and go, oh, we need to replace the misfolded proteins. You think to yourself, is it getting enough water? Is it getting enough sunlight? Is it at the right temperature? Is there enough nutrients in the soil? Is there maybe something toxic that got into the soil? Right? We think through what makes this complex organism thrive. And my research, my experience has shown me that when we apply that same sort of paradigm of if we take this complex system, what are the things that might be out of balance at a causal level that can lead to neurodegeneration? Instead of suggesting that the amyloid plaque is at fault, we know that amyloid plaque is actually upregulated to defend us from infections like herpes, porphyria gingivalis, which causes gingivitis, the Lyme spirochetes, and many other infectious agents that can actually get into the brain and trigger an immune response. What happens? Amyloid comes to protect us. So this idea that amyloid, if we remove amyloid, this has been tried again and again. Billions of dollars have been poured into this research. Some of it after, unfortunately, a paper that was published around 2006, which was based on falsified images. This was as people were starting to shift away from the amyloid plaque hypothesis. There was a paper on mice that purported to connect cognitive decline with amyloid. And unfortunately, that was doctored research. It was based on a sham. And this was cited well over 2,500 times. It was a very, very influential paper that justified more research dollars going down the path of amyloid. And for a long time in research, if you weren't studying amyloid, you weren't studying Alzheimer's. And so I think there was a lot of misuse of funds and energy and effort, unfortunately. And so the the goal now is to help people who are suffering, right? Everyone, I think, comes to this well-meaning. We all want solutions. This is a disease that can bankrupt families emotionally, yes, financially, physically. It is extremely exhausting to take care of someone with Alzheimer's. And so how can we reduce that burden? How can we reduce the suffering? If we shift the paradigm into thinking about this from a complex system science perspective, how do we create more balance in the system? How do we get rid of toxins? How do we balance the nutrients? How do we make sure stressors are balanced, structural issues are supported, that infections are resolved, and that signaling, whether it's hormones, sex hormones, stress hormones, vitamin D, brain-derived neurotrophic factor, there are lots of signals that can go to our brain that can either be supporting a regenerative state, the creation of new neurons, of new connections between them, or can be supporting a state that's about defending and attacking, right? We want to shift from that defense and attack mode into the regeneration healthy mode.
Mm. So I would love to kind of walk through different phases of life and hear kind of what the research is pointing to in regards to recommendations. So, uh, let's take just kind of middle age. So people in their 30s, 40s, 50s, like what can they be doing in regards to kind of practical decisions, whether it's with their lifestyle, their eating habits, that is going to help set them up for the best success. Now, we can probably never guarantee that if you do X, Y, and Z, that you'll never have dementia or Alzheimer's. But like, what's the research pointing to that are habits? And maybe what I just said is not even true. But what are some habits or some ways that we live our lives middle age that is going to give us the best kind of set of outcomes with dementia and Alzheimer's?
Yeah, great question. So, what we see in the research, this is actually hot off the press. Just on June 7th, Dr. Dean Ornish from UCSF published the first randomized control trial showing that lifestyle interventions can improve significantly improve cognition and function after just 5 months in patients with mild cognitive impairment or early dementia due to Alzheimer's. Now, you asked about people who are earlier on, right, before they're experiencing any symptoms. But the reason I like to point to this kind of reversal state where we already have symptoms and then we're getting better is because if we can reverse this disease, then we can most certainly prevent it, right? And yes, you're absolutely right. Not necessarily for everyone. There are going to be people where we're scratching our heads going, why did this happen? Or they're doing everything to get better and they're not seeing the benefits. And one of the things I love about my mentor, Dr. Dale Bredesen, is he's always asking, hey, Heather, who's not getting better? Let's do a case review and try to figure out what we're missing. There's some component missing. There's something we don't know about yet. Let's advance the science. And so it's Dr. Dean Ornish's work, this again, first randomized control trial comparing a control group to an intervention group, statistically significant differences between the two after just a 5-month intervention that was based on diet, exercise, stress management, group support, and also a handful of supplements. So the idea here is if we can start doing these things earlier on. And so how do we know if we're in our 30s, 40s, how do we know how aggressive we need to be? Well, we can get genetic testing done. And 10 years ago, I probably would have, as a clinician, talked someone out of getting their genetics tested because there was this refrain that there's nothing you can do. So why would I stress out about knowing my ApoE status? I want to explain ApoE really quickly because these genetics are very helpful and I think very empowering. When we know, so ApoE is apolipoprotein E, and this can change both cardiovascular risk and dementia risk. So we get one copy from mom and one copy from dad of ApoE. So we end up with two of them, either a 2, a 3, or a 4. So there's three potential options from mom and dad, and we get two of them. So we can have a 3-3, a 2-3, a 3-4, or a 4-4. And there's other combinations, but essentially the worldwide population has about a 13% chance of developing dementia in their lifetime. If you have one copy of ApoE4, so typically this is a 3-4, you become 30% likely to be diagnosed with a dementia or Alzheimer's. And if you have two copies of the 4, one from mom and one from dad, if you're ApoE4-4, you have a much greater than 50% chance of developing Alzheimer's in your lifetime. And so, if we know this in our 20s, 30s, 40s, we can be much more proactive about the lifestyle interventions and maybe even layer on some of the medical interventions, looking for toxicity, looking for infections, treating them more aggressively, making sure our nutrients are well balanced, getting more aggressive about a prevention strategy because we know we have genetic risk helps us to, at the very least, delay the onset of the disease process.
Mm. Now, is that a test that can, like any primary care doctor can just like order, or is that something that you have to go through like special companies or things like that for?
That is available through LabCorp, Quest. Any of the lab testing companies can do that. You can ask your primary care provider. You may have to pay cash out of pocket, depending on your probably family history. And then it is also available, you can get this directly through any of the genetic testing companies online.
Okay. And what was the name of that test? Because I think if we're starting there, I want to make sure I caught that for myself.
Yeah, it's ApoE, apolipoprotein E, or APOE. E is an elephant.
Awesome. Do you often find yourself overwhelmed by the influx of client calls you receive? Receptionists are expensive, but you can't afford to let your patients go to voicemail. You care for your clients, so you try to phone them back, but more often than not, it's too late. They've gone to another practice. When you partner with Well Received, you capture every opportunity. Your calls are answered by professional medical receptionists 24/7, and they can support you with more than just message taking. They offer new patient intake, after hours service, bilingual services, medical appointment scheduling, medical live chat, and so much more. All this at a fraction of the cost of an in house receptionist. Your patients are Well Received's priority. As a Practice of the Practice listener, you can get an exclusive 50% off your first 2 months of service. Head on over to wellreceived.com/Joe to start growing your practice today. What are you doing October 1st through 3rd? I want to hang out with you just south of Nashville, Tennessee, down in Franklin. I'm going to be keynoting the Mental Health Marketing Conference, and I would love for you to be there. We are also sponsoring the clinical track, where there are going to be tons of amazing trainings, all for you in private practice. This is the national gathering for marketers and clinicians in mental and behavioral health. You're not going to want to miss this awesome conference. It's the one conference I'm keynoting this year, and you can read more over at mhmarketing.org. Also, Steve over at Mental Health Marketing has given 25% off to any Practice of the Practice listeners that want to come to this. Whether you're coming in person or online, you're going to want to use promo code Joe at checkout to get 25% off. I would love for you to come in person for my closing keynote on Thursday, October 3rd at the Mental Health Marketing Conference. But if you can come online, that works as well. Can't wait to hang out with you in Tennessee. Again, that's mhmarketing.org, and use promo code Joe at checkout to hang out with me October 1st through 3rd, 2024. So once you kind of know those things, are there lifestyle things that people should be doing across the board? Or is it more kind of what I'm hearing, and tell me if this is correct, is that if you know that you have that, say, 50% chance, then you can make different decisions going forward. Does the average population need to be making adjustments in their lifestyle to reduce the chance of Alzheimer's or dementia? Or is it really, if that apoprotein E is there or not there. I clearly don't know the science. That you have that 50% chance that then you should be making those decisions.
Yeah, this is such a great point. So, my colleagues, other people who are studying diabetes, you mentioned you have type 1 diabetes. This is often more in type 2 diabetes is more where we would apply these ideas, but type 1 diabetes as well. You need blood sugar well managed. That has a big impact on the rest of our body. And then in the aging space, right? How do we age gracefully? I was just talking to Dr. Terry Walls this morning, who's in the MS space. She suffered with MS and recovered from her MS. There are lots and lots of diseases associated with aging that this applies to. What we see in my clinical practice and at the residential care facility we created is that people get off of their antihypertensives, their medications for high blood pressure. They get off their diabetes medications. They get off their antidepressants. That many of the diseases associated with aging, including osteoporosis, improve as we start on this protocol. And so why not start earlier? But there's a couple of things that are specific to cognitive function. I think to quality of life as well, but specific to cognitive function, there are a couple of things that you can do that you probably haven't heard of. So of course, the diet, exercise, sleep, stress management that you hear across the board. And actually Dean Ornish, the paper that I was just referring to that was published last week, the same protocol was used for heart disease as was used for Alzheimer's, and you get beneficial results in both cases. So I wouldn't say, although I speak from a place very much specific to cognitive decline and the struggles that are unique to caregivers and to patients in that space, this is an approach and a protocol that is really about healthy aging so that we can maintain fulfilling lives throughout every phase of life. And so I want to jump into two really specific things for cognitive function that are important, whether you're in middle age or later on. But I want to make sure if there's other questions that we double click
No,
here.
let's dig in.
Okay, so with exercise, many of you probably haven't heard of dual task exercise. So dual, DUAL, as in two things at the same time. So what we want to do here, this is based on the literature that says that you get more out of your physical exercise if you combine it with cognitive exercise. So what does this look like from a really simple perspective is just going for a walk with someone you enjoy and having an intellectually stimulating conversation. It might also mean going to a class like a yoga, Pilates, Zumba class where you're cued by an instructor. And so you have to cognitively stay engaged throughout the class while you're physically engaging, right? And so this is going to be different for different people, right? If you go to that yoga class every week and you know what the instructor is going to say before she says it, then you've got to do something more cognitively stimulating. If you can check out and think about your laundry list of things to do, then you're not cognitively engaged enough. And this will be dynamic, right? As we become stronger, we're going to need to up the ante with the physical engagement. So you want to be in kind of that 70 to 80% effort range, both cognitively and physically at the same time. And we see improved cognitive benefits, balance benefits. We see just better outcomes generally when we incorporate those two efforts together.
I
Second
love
is
hearing
sleep.
that. I love hearing that. My friend Taylor and I go for walks about once a week, and we have deeply intellectual conversations. So that's good to reinforce that. It makes me feel a little better about what I'm doing. I'm not like a hard workout guy, and sometimes I feel guilty about that. So that's good to hear. That idea of pairing it would even just like if someone's on the treadmill and reading, like would that kind of thing count too?
Well, don't fall. But
Right.
no, it can. I'll go for a run and I'll listen to a podcast, but I'll also find myself kind of zoning out when I'm listening to Peter Attia or Andrew Huberman, right? I'm not always present with it. And so what I have to do is pause it. And then if it's appropriate socially, I'll say out loud what I just learned. And that keeps me more cognitively engaged. So if you find yourself zoning out or if it becomes, a gossipy conversation that's not intellectually stimulating, then it's not enough. Or if you're not walking fast enough to get your heart rate up, you don't want it to be so hard that you give up, right? Either physically or cognitively. And you don't want it to be so easy that you're just cruising. It's not a stroll in the park while you listen to a romance novel, right? It's more than that.
Okay. What else?
So when it comes to sleep, We want to be aggressive about treating sleep apnea. So, with sleep, we need both quantity, enough, at least 7 hours, and we need quality. We need REM sleep and deep sleep for many, there's lots of mechanisms associated with this, but more or less with deep sleep, what we get is the rinsing of that glymphatic system eliminates the amyloid plaques that can build up. It eliminates the toxins that can accumulate just from regular cell metabolism throughout the day. So if we skip that, we end up with the accumulation of amyloid. We see this in people in their 20s and 30s. Just one night of sleep deprivation, you have a measurable increase in amyloid in the brain. This is one of those misconceptions, is that people think that amyloid is only associated with older brains, but people from anywhere from 2 years old to centenarians, only 2% of the population doesn't have amyloid plaques present. They are there. It's just a matter of whether or not they are affecting cognitive function. We also see that in centenarians who have really wonderful cognition, who have no measurable decline, they can have amyloid present. So just because you have amyloid doesn't mean that you have the clinical signs of Alzheimer's. So there's kind of a misconception there. However, there is a distinct correlation and a connection between amyloid and cognitive decline. So when you see that being elevated, it means that something is dysregulated, something is out of balance. And when you don't get sleep, that amyloid in the brain goes up, even in your 20s or 30s. So we want enough sleep. We want to be prioritizing sleep. And then if sleep apnea is present, this is a really, really, really big deal. With my patients, I used to wait until somebody told me they snored, or if I saw that they were overweight or mouth breathing, then I would be more likely to order a sleep study. Now, if someone tells me that they have any cognitive decline, I recommend they be screened for sleep apnea. So, sleep apnea is the closing of the airway when we are asleep at night. And the brain wants sleep so badly that it often won't wake you up for a while. So, you become hypoxic. You don't have enough oxygen in your blood. You can't get enough air in through your mouth. You really should be breathing through your nose. So when we can't get enough air in through our mouth, then the lungs are not getting enough oxygen and we can't get the oxygen to our brain. Our brain, when it is under hypoxic conditions, can start to atrophy. There can start to be neurodegeneration. And I have had the pleasure of seeing a couple of patients in my office over the last couple of years who've come in with very low MoCA scores, and they have transformed when we start them on CPAP. So when we get their sleep apnea diagnosed and then treated. Now, some people will say, I can't handle a CPAP. I don't want to wear the mouth guard. If you have mild sleep apnea, even just mouth tape can be helpful. Sometimes weight loss can be helpful, but getting whatever support you need, making friends with your CPAP or your APAP or getting a different device. Sometimes people like the pillows or there's a little inflated pillow that sits under the nose, or some people prefer the travel version of the CPAP to the at-home version. Finding something that works to keep your airway open is absolutely crucial to brain health as we age. The quality of your life will go downhill if you cannot get deep, restful sleep at night.
Mm. Well, I'd love to move into what we can do to help our parents. A number of listeners are kind of in that age demographic where they're raising kids and they also have older parents, or maybe some of our listeners are still practicing and maybe they're in their 60s or 70s. What would you say is important for people in that age demographic to know?
Yeah, caregiving for someone with Alzheimer's or dementia is not a one person job. Full stop. There needs to be help. And even before you realize that you need help, that's when you should be getting it and setting it up. I've seen too many families who are backed into this corner of desperation where there has been a primary caregiver, primary care partner, a spouse, or an adult child who then all of a sudden is called away because of a grandchild or their own child, or they break a hip, something comes up, they end up hospitalized for some reason, and they are not able to care for that person with dementia. And they're left panicked and desperate for just a warm body to show up and keep their loved one safe. I really, really want to emphasize just how important it is for care partners to be managing their own self care, to making sure they are getting exercise and sleep and stress management and a good diet, that you don't provide the best care if you aren't caring for yourself. So I recommend at least 8 hours off per week to not go jump up and take care of a grandchild or someone else, but really to take care of yourself, to invest in that self care so that you can come back to your loved one rejuvenated and feeling re-inspired. And you do a better job caregiving, and caregivers have anywhere from 2.5 to 6 times the risk of being diagnosed with dementia later on. So, just caregiving, serving as a caregiver, increases your risk of developing dementia later. And who's going to care for you? We have to make sure that you are doing the prevention that your loved one might want to do as well. And so, doing this together actually makes it more successful. People enjoy it more, they feel more connected to each other. We see better success outcomes when you get into ketosis together, when you're exercising together, when you're prioritizing sleep together, getting that good sleep hygiene in, and maybe going to church together or creating daily prayer or meditation practice together. So, for those supporting loved ones with dementia, just I commend you. I thank you. You are doing extremely hard work. And the person that you described who's still working, raising kids, has a family and a household and a relationship to manage, and then their parent ends up diagnosed with dementia and needs more help. This was why we created Marama, the residential care facility, where people can go for an immersive experience in Dr. Bredesen's approach. And what we've seen there is that many people improve their cognition. And if they come early along, early enough along the disease process, we actually can return them to independent living. And that transforms memory care into memory recovery. And so this process, it has huge potential to improve the function of our loved ones so that we can get that one more Christmas, that one more anniversary, that one more summer season with someone who's cognitively present and able to engage. Not always. There's no guarantees. However, there are resources for doing this at home, including, of course, my book is written so that people don't have to move into senior living, so they don't have to move across the country or be apart from their loved ones. They can do this at home. My hope is that over the course of my career, we make memory care obsolete, that people can stay in the fabric of their communities around their loved ones and be able to get this support at home, be able to change their lifestyle. If, like we were talking about earlier, if you can do this in your 20s and 30s, we can make dementia rare and optional when we get to our 50s, 60s, 70s, and 80s.
In the last couple minutes, I would love just any tips for example, my parents. If I have a conversation with them tonight about this podcast interview, what are some lifestyle things that, as a family, we could do that is going to help them? They don't have any Alzheimer's symptoms. They don't have any Alzheimer's or dementia worry at this point. But what are things, that, as 70 somethings that I can say, hey, let's try some of this together. Are there ways that we can eat different things we can do in our lifestyle that is going to give us the biggest bang for our buck?
Yeah, I recommend an organic ketogenic diet. And if restricting carbohydrates that much feels overwhelming, just eliminating processed foods. So, getting rid of anything in a package, any carbohydrates, especially that have been processed into bread or pasta, or of course, the candies and added sugars, we want to eliminate those completely as much as possible. And then if we can increase veggies, of course, and make food at home, it doesn't have to be elaborate, but it can be fun. This is creating new recipes and cooking new things, shopping a little bit differently. This can be like bicep curls for our brain when we engage in this executive kind of function, right? Of planning, maybe researching online or getting out a cookbook and researching and getting excited about what we want to make, and then going to the store and going through the process of deciding on what we want to make and then actually creating that meal, enjoying that meal with loved ones, and then cleaning up the kitchen, right? All of these things, that sequential process of creating a meal is a way to engage cognitively, particularly when it's new. So learning new things and making it fun. So maybe it's picking up pickleball, where we talk about in the book, if you could only do one thing, we want to make this manageable, but then also we want to make it efficient, right? So if we can go outside with a loved one and play pickleball, which is a new sport that requires hand-eye coordination, and we're socializing with other people, plus we're getting the vitamin D from the sun, all of a sudden we're checking a bunch of boxes of things that we want to do throughout the day. If we can go to church or a sangha or some spiritual place where we socialize, we spiritually drop in, we feel supported, we feel less stress. Maybe there's a support system, the support group there. When we can check multiple boxes with each of our efforts, kind of like the dual task exercise, right? Where we can exercise both cognitively and physically together, that can make this feel less overwhelming and we can get more benefit. As a family, when we decide to prioritize our diet or when we start to exercise together, the classic, my family has done this forever, right? We show up with a bottle of alcohol, right? A bottle of wine and cake or cookies, or right, we're celebrating in our families with poisons for our brain. If we can instead shift that to say, okay, what we're going to do is prioritize showing up with a fresh salad or some grass-fed meats, fully grass-fed meats or pastured eggs, something really healthy for us as gifts. Or if we start gardening together, doing something creative, we engage in these pursuits that support our cognitive function together and we encourage each other and celebrate wins, then we can start a momentum towards creating a really brain healthy lifestyle.
Mm. Heather, the last question I ask is, if every private practitioner in the world were listening right now, what would you want them to know?
It is possible to reverse the symptoms of Alzheimer's. And with a comprehensive toolkit from a complex system science perspective, a functional medicine or naturopathic perspective, you have all of the tools you need to support your patients in that.
Mm. So awesome. If people want to get your book, tell us more about where they can get it.
Yeah, it's available wherever books are sold. And I'm hopeful that this book has a ripple effect. It's called Reversing Alzheimer's, the new toolkit to improve cognition and protect brain health. My name is Dr. Heather Sandison, and you can find out more about me at drheathersandison.com. The book has many bonuses that come with it, including a workbook that can help you individualize and guide you through making this lifestyle yours so that you can reap the benefits of optimal brain health.
Thank you so much, Heather, for being on the Practice of the Practice podcast.
It's been a pleasure. Thank you, Joe.
Well, I don't know about you, but I am excited to evaluate my lifestyle, the way that I choose to live, maybe even get some of these evaluations, like thinking about, I'd like to know my risk in regards to the future. I'd like to know if, sometimes my tiredness in the morning or dependence on coffee based on some sleep apnea. I don't think that I'm snoring, but I mean, I think even just evaluating some of those things, as someone in their 40s, I want to be able to be around for my daughters as much as possible and be able to enjoy life. So hopefully this was personally something that you enjoyed, also something that maybe for your clients or your parents, maybe something, or for you personally. So thanks so much for hanging out. I can't wait to hang out, hopefully with you, down in Tennessee. I'm going to actually be down in Franklin, Tennessee, October 1st through 3rd for the Mental Health Marketing Conference. I'm actually keynoting that, talking about Thursday is the new Friday, but I'm going to be there for the entire conference, flying in earlier in the week to hang out with some of the podcast sponsors, to hang out with different sponsors from the Mental Health Marketing Conference. But my keynote is on Thursday, October 3rd. It's the closing keynote. If you are a clinician and you want to come, I would love for you to be there. We are actually sponsoring the clinician workshop track. So October 2nd, I'll be presenting in the afternoon also. So if you want to hang out with me down at the Mental Health Marketing Conference, again, that's October 1st through 3rd down in Franklin, Tennessee. So you'll fly into Nashville, head south about 30 minutes and hang out there. It's the national gathering for marketers and clinicians in mental and behavioral health. You can find out more over at mhmarketing.org. And if you use promo code Joe at checkout, you'll get 25% off the ticket. We have an awesome back and forth with the Mental Health Marketing Conference. We're so excited to be supporters of them. We're excited what they're doing. It's really just so amazing to see people coming together around this. And also, we couldn't do this show without our sponsors. Well Received is our sponsor today. Well Received is what I wish I had when I had my private practice before I sold it. You miss so many opportunities when you don't have someone answering the phones. And a 24/7 medical receptionist often is really expensive to have someone on call for that sort of thing. But Well Received helps you do new client intakes, after hours phones, bilingual services. They get intakes all scheduled for you. Your patients are the priority for Well Received. And as a Practice listener, you can get 3 months for 50% off. So head on over to wellreceived.com/Joe. Again, that's wellreceived.com/Joe, and you'll get 50% off your first 3 months to have all those people helping you with answering phones and getting people scheduled. Thank you so much for hanging out today. We have some really awesome things coming up in the future here. We've got some discussions on AI. We've got some discussions on how to talk about race in the therapy room. We talked about how do you add a fitness center to a counseling practice, and then a bunch more in the coming months. So thank you so much for letting me into your ears and into your brain. Have an amazing day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.